Most Americans probably have a vague awareness of the worldwide water crisis. They may even know that more than 1 billion people lack clean water, or that every 21 seconds a child dies of a water-related illness. But it's easy to feel helpless when you hear such grim statistics, and it's hard to put a face on 1 billion people. Like a lot of things in life, it's hard to help when you don't know where to begin. Maybe a better way to look at the problem is to start small. GiveSafeWater works at the grassroots level to help communities in Central America and beyond gain access to clean water. Unlike other parts of the world where people walk for hours to find water sources, proximity to water is not the issue in Central America. Access to clean water is.
Dirty water undermines everything you want to do. It knocks the kids out of school. It means people who are trying to pay back their microenterprise loan or trying to decide between paying back and buying clean water.
In rural areas, for example, you have the water wells. At the same time, you have the latrines. And, underground there is a connection.
At some point, the water is connected through the lakes, the rivers, the oceans, and if it's becoming deadly here, it's a threat to, I think, everybody.
But as dire as this health crisis sounds, the solution is actually quite simple. Because what's needed is water purification, which is far less costly than getting water into communities. And to make it easier, we found a company called Sawyer, which has created a water filtration system based on the medical technology used for kidney dialysis machines. That sounds expensive, and when the technology was first invented, it was. But Sawyer is now able to make an affordable water filtration system, which is a wonder of simplicity. You drill a hole in a 5-gallon bucket and install the filter in a matter of minutes.
Having it be that simple is really important. But it's also pretty fail-safe. It's just an excellent product.
Because some other filters, good ones, but perhaps require a little bit more knowledge and technical training to build them. So to have a filter where you just have a membrane, which is capable of obstructing all this polluting material, and the way to clean it is just to reverse the water flow, I think that is really great.
Because the filters don't require electricity, they can be used in even the most challenged communities. But before we distribute the filters, we educate the recipients about waterborne illness. And one filter will provide clean, healthy water for a family for up to 10 years. That's 10 years for a family that won't have to worry about losing productivity to illness. 10 years of healthy school attendance. 10 years of time which will now be spent empowering individuals to build stronger communities.
Kids don't miss school, mothers don't miss work.
Since we've participated in the filter program, absenteeism has dropped off dramatically. School attendance is up 98%.
At GiveSafeWater, we believe it's the small steps taken that can transform the world. Our initial goal is 1,000 donations of $100. Since we ask each family of filter recipients to share the filters with 3 other families, our initial goal will reach 4,000 families.
You could potentially give 20 people clean and safe water for a fully deductible $100. And it's just going to improve lives for a long time. And I think a lot of people would like the opportunity to make that kind of a difference on humanity for $100.
Real change and long-lasting change can come from the grassroots.
If you want to really change health overnight in a community, you change water.
We're asking for your help in getting water filters to the families who need them. Visit our website at GiveSafeWater.org to see how your small donation of $100 can have a huge impact. Join us in helping create a ripple effect on thousands of lives in Central America and beyond.